Hi, you are tuning in to AWANI Review with me, Cynthia Ng. On this show, we speak with individuals shaping the future of business and society. In 2018, Asia Talent Cup rider Danial Syahmi suffered a horrific crash that saw him thrown off his motorcycle and then run over by a fellow racer on the Sepang International Circuit. He suffered serious injuries, shattering his lower right leg. Initially, it was believed that his leg would have to be amputated due to the severity of the injury. However, thanks to early treatment from General Hospital Kuala Lumpur, followed by stem cell treatment at Kuala Lumpur Sports Medicine Center, he has been able to regrow his bones relatively quickly. I am honored today to speak with Daniel's doctor, Dr. Saw Khay Yong, founder and director of the Kuala Lumpur Sports Medicine Center. Thank you, Dr. Saw, for coming on the show.
Yeah, thanks for inviting, Cynthia.
Well, Dr. Saw, I would like to start to talk about Daniel's case, Danial Syahmi. Now, we understand that he would have lost not just his career in motor racing, he was close to losing his leg from that accident in Sepang 2 years ago. So let's start with that, right? Tell us what went through your mind when you first got Daniel's case.
Yeah, I was approached by Dr. Ranjit, my colleague that works with us, and because he's operated on Daniel's, I think, collarbone before. All these guys, they fall all the time, so they have a lot of injuries. And he showed me the pictures and he said, can we do something for him? So when I look at the X-ray, the bone is totally shattered, and I was like, poor guy, can we do something to save his leg? Because Dr. Ranju was telling me that we don't do anything, he may lose his leg. So I thought, yeah, we can, and let's make sure that if they really want to come down this road, then we probably have to think about how to use stem cells to assist the bone healing. Because this problem is like 13 centimeters of bone that's missing. So there's a lot of technologies out there to rebuild bone or bone graft or whatever, but it's okay with small section of bone, but this is a huge section of bone. So then we decided that, okay, fine, we will admit him and assess him. And initially, because of that type of injury, there's a lot of soft tissue problem as well. So we had to do some skin grafting for him. And then unfortunately, he also had the worst case scenario type of infection called MRSA. So this is the antibiotic resistance bacteria. So, but eventually we managed to eradicate that with some strong antibiotics. So then we thought, how do we build his bone? There's a technology called the Elizarov principle, Elizarov frame, and this was started by Professor Elizarov in Russia. So it's a Russian technology that uses a circular frame. And if there's a missing bone, so what the technology uses is to divide a section of the bone, a normal bone, and then transport this section of bone towards the defect. Okay, but when you divide a piece of bone, the natural healing process of the body is to heal, to form bone. So as the bone is forming, the frame then just stretches that 1 millimeter per day, and that is where the new bone is growing. Now, our innovation with stem cells is that where we inject the stem cells into the growing bone to assist the bone to heal a lot faster. So if you imagine if a leg is run over by a bike tire at like 200 over kilometers per hour, it's not just the bone that's injured, the soft tissue is injured, the blood vessels are injured, and for the body, for the bone area to recruit all these stem cells to rebuild his bone is going to be difficult. So instead of relying on body's normal way of healing, that may not happen. So we are assisting nature to put more of the building blocks of stem cells into the growing bone, and then allow the bone to heal a lot faster and eventually form a better construct.
So essentially expediting the recovery process.
That's right. And basically providing more cells that can differentiate into bone, and that allows the bone to heal up a lot faster.
Just how much time difference would it take, for instance, for Daniel to go the conventional way, if not for the stem cell treatment that you had administered to him?
So, when everything was finished, we published our paper in a Malaysian orthopedic journal as a case report because when we searched the literature, we realized that what we've done for him with stem cells has accelerated the healing process. Normally, the process may take twice as long. So he was in the frame for about 10 months. Normally, you may be talking about maybe in the frame for 2 years or something like that. And then when we look at all the papers that were published, when you grow a large piece of bone that you try to regenerate, sometimes the bone don't heal so well and they are a bit crooked sometimes, and then the bone is not consolidated so well, and you can have earlier fractures to that regenerative bone. So I really think that with the stem cells, it assists us a lot to cut down the time and also to make the bone a lot stronger for him.
Now, I understand that Daniel has resumed riding. Is he completely healed?
Well, from his bone point of view, so from the regenerative bone point of view, I mean, the bone is strong enough for him to put weight and everything. But injury like this, I mean, the knees, the limb is not normal. I mean, we have to do a skin flap. Our plastic surgeon have to do a skin flap to cover part of the area which is has some soft tissue damage there. He still has some knee issues that needs to be addressed. So eventually, he may need further surgery to address his knee. But those injuries to the knee is not stopping him from riding.
Okay, now I'd like to take a step back from science and Daniel and just to talk a bit about yourself and the Kuala Lumpur Sports Medicine Center, which you founded. Why sports medicine for you?
Well, when I first came back from the UK more than 25 years ago, after spending like 15 years in the UK, and during my training, I did a lot of fellowship program. I traveled to many parts of the world. I did trauma fellowship in Graz in Austria. I spent some shoulder fellowship in Salzburg. I spent time in Pittsburgh and even Anchorage in Alaska. Those are the few places that I've been. We want to subspecialize into focusing on treating patients better. So, for example, our hand surgeon, Dr. Ranjit, he only does hands, but he can do a very simple sprain of a finger to a replant with microvascular surgery. And then we have our own hand therapists to treat that rather than also occupational therapist. So it's the same for the knee work that I do. I can treat a simple knee sprain to cartilage problem with stem cells, and then with rehab with a physiotherapist who are seeing knee problems day in, day out and everything. So when you're talking about subspecialization, I believe this is the future medicine. And that's why you see now, I mean, there are general surgeons who specialize in treatment of the bowel, and there are general surgeons who do, for example, breast surgery. So these are, I think that's the development of medicine to subspecialize, and that's the natural history. I think if you want to be good at something.
I'd like to understand you a bit more. There was a quote that I saw on an interview you did with The Edge. You said that orthopedic surgery felt like high-end carpentry for you, which I thought was quite interesting. How is that so? How did your interest in this? How did you develop your interest in this?
Well, when I was young, I used to do a lot of different things, from carpentry to take out our home lawnmower and strip it apart and put it back together. And by doing that, you do a lot of hands-on things, and orthopedic surgery is something like that, and we use drill, we use power drills, we use powered instruments, we have reamers, we deal with screws, we deal with nails, we deal with things like that. So for example, if you do a hip replacement, you need to have a saw to take out part of the hip joint, replace it with a cement and plastic and everything. So it's a bit like carpentry, but really high-end carpentry.
Okay. Now, at what point did you merge the stem cell research and innovation in stem cell into your specialty, which is orthopedic surgeon?
Yeah, you see, as a practicing orthopedic surgeon, when I first came out to private practice after spending 3 years with a government service, when I came back, um, I did general surgery. I did general orthopedic surgery. So I'm seeing from back pain to foot pain to ankle sprain and everything. But my passion was to do arthroscopic surgery, that means keyhole surgery, because it is minimally invasive and a lot more satisfying. So
Mhm.
when you started doing a lot more of this arthroscopic surgery, I used to treat a lot of professional footballers and our national athletes. And we realized that one of the problems that they have is cartilage problem. So if a 30 years old footballer with a cartilage defect and they will have pain, so they can't go back to the previous before injury because that cartilage defect is giving them problems. So I looked at what's out there, and there are microfracture surgeries that people do, punch a few holes and expect the cartilage to grow properly, but they don't do so well. There are other procedures. For example, you take cells, you culture it, and open up the knee and patch it in. And again, I don't like to open up the knee joint and patch something else in. And again, those results are not excellent. So this is like back in 2005, we thought, is there a better way of doing it? So I thought, why can't we just modify the microfracture technique? We drill it and then add stem cells and see whether that makes a lot of difference or not. So we started doing some animal work. We team up, collaborated with UPM, the veterinary uh, department of UPM, and we did some animal work that showed that when you add stem cells into the knee joint, um, after you drill, we can regenerate very good cartilage. So from there, we published our paper in 2009 that showed that when you have stem cells, it's definitely better than no stem cells, okay? And you can regenerate good cartilage in a good model. So from there, we move on to a human model, and we started doing our phase one. That is that you do a few cases and we do a 2 monthly MRI scan to follow up the cases, and we looked at it and it looked so good. So then we had a few years later we have opportunity to have a second look arthroscopy to look inside the joint, to look at the cartilage that's growing. We took some pictures, we took biopsies and showed that we with stem cell we can then regrow hyaline cartilage, which is the cartilage that we want in a normal knee. So we published that paper in 2011 and talked about surgical technique, how we modify the surgical technique. And then in 2013, we published our paper, a randomized control trial, and we got some funding from MOSTI, which is Ministry of Science, Technology and Innovation. They gave us some funding. And so we managed to do a randomized control trial, and that trial proved that really when you drill into the joint, stem cells definitely give you a better quality of cartilage. So
Yep.
so that was the key of that. Okay. And moving forward, and then in 2015, we published another paper that showed that even in the worst case scenario, patients who are bow-legged, we correct the alignment and put stem cell, we can grow very good cartilage, and which is almost like 95% of normal cartilage. So with that results that we have, we then decided that to do a US FDA trial. So with my colleagues in the US, because they wanted to bring this technology to the US, we then started doing our phase 2B US FDA trial. And we just concluded the trial last year. And so we are finalizing the trial and everything now. And the trial showed that in massive cartilage lesions, so the trial includes patients, young patients 18 to 55. And these are patients with massive cartilage lesions and what we call unmet medical needs. So if a 40-year-old with a huge cartilage defect, some of them, the only option for them is actually a total knee replacement, which is replacing the joint with metal, plastic, cement, and everything. And those joint replacements are not suitable for young patients. So we took this group of patients and run them through a US FDA trial between here and also our colleague in Pensacola in Florida. And our results showed that in this massive cartilage lesion, the additional stem cell after we drill into the joint has got very safety record and efficacy data to show that it works in massive patients, massive lesions like this, and which is basically unmet medical needs.
So where does Malaysia stand in terms of stem cell research and stem cell therapy?
Well, I can say about what we do in orthopedics for cartilage. So if you look at what we do for cartilage, because we can address our medical needs, you'll be surprised that, because of the MCO at the moment, otherwise I have patients from the States, from UK, Europe, surrounding area, Vietnam, Indonesian, even Singaporeans come here for the specific work that we do for cartilage. So I think from a cartilage point of view with stem cells, I think we are the leaders there. Okay, but there are a lot of other stem cell work that's done by other colleagues out there, but I'm not sure where they stand on the world scene. But from the cartilage work, I think we are probably leading that.
Now, Dr. Saw, when talking about stem cell research, it has gained significant advances over the years, but it is still quite an ethically and politically controversial subject, as it involves, human experimentation. It involves some level construction of human cells and embryos. What is the conversation in Malaysia in terms of supporting research and also the growth of stem cell research?
Yeah, I think for what we do, I mean, we're using patients' own cells. So we're talking about, I'm taking patients' own blood cells. And that technology of harvesting patients' own blood cells have been around for the last 20, 30 years or more than that, because these are the same technology that the hematologists, which are the blood specialists, harvest stem cells for bone marrow transplant. So what we are using is ethically, basically, there's no ethical issues at all. We're not dealing with embryonic stem cells that we have to deal with embryos. So the cells we're using is patient own cells. We call it the autologous cells, and it's been around for a long time. And what we have to do through an FDA trial is to show that this patient's own autologous peripheral blood stem cells can regenerate the cartilage that currently do not have a good solution for. So from the ethical point of view, for what we're doing, I think, it's not really a big issue. But I agree, that's why you saw that we did our animal work to have a proof of concept, and then do a phase 1, and then a phase 2, and the next phase for us, perhaps when the COVID is under control, we have to then embark on our phase 3 FDA trial, which is what we plan to do. So that
what happens then after the FDA trial, the third one? What happens? Yeah, how would it contribute to your research?
Once you finish the US FDA phase 3, then you theoretically can market this in the US, and then hopefully the rest of the world will look at the phase 3 FDA results and then adopt the same technology. So it's the same as the COVID vaccine. You've done a phase 2, you heard about the phase 3 trial now, and then even Malaysia, our MPRA, our National Pharmaceutical Review Agency, it's looking at the data and even doing some measures here in order to show the safety and efficacy of the vaccine. So like any new technology, every country will want to evaluate the results. And the most important thing is safety and efficacy. I think safety is very important, efficacy is very important. So, we've been doing this for the last 13, 14 years now. So we are still bringing back our patient 10 years down the road. We are talking about phase 4 long-term study, and we're bringing patients back. We do an X-ray and MRI scan for them. And the reason why we're doing that is to look at, are there any complications from the stem cell we be injecting into the knee joint? And we have done almost 1,000 cases now in the last 14 years, and we do not see any problems at all. So it's good because I think, firstly, you're dealing with patients' own cells rather than cells coming from somewhere else or from other person. And looking at our long-term data, we know that the stem cell that we use for regenerating on the cartilage. Firstly, the cartilage is pretty resilient because it's a good quality of cartilage, and also it's safe, and the results are good even in cases of unmet medical needs. So that's just the cartilage we're talking about. But because we've been dealing with stem cell for the last 13 years or so, we also use it for bone regeneration. So I've done some bone regeneration with that, but not at the extent of what we did for Danial. But if we didn't develop this technology 13, 14 years ago, I won't be applying this technology to Daniel, But other things that we're doing is, for example, tendinitis. Some athletes has got tendon problems that will not heal with traditional way of doing things, and we can use stem cells to accelerate the healing process. And that's what we've done for many of our national athletes as well.
Now speaking of safety and efficacy, right, we are seeing more boutique medical firms claiming they can perform groundbreaking stem cell therapy. Some are quite questionable. So how can somebody who wants to take on this therapy, how can they distinguish between a genuine practitioner and a fake one?
I think, look at a track record, and if it's something that's new, I mean, are there any publications anybody else is doing that? I think that's why we have to publish in peer-reviewed journals with high-impact peer-reviewed journals. If you don't publish, then it can be anything. I mean, I can say that I can treat a 60-year-old knee and inject stem cell and make it look like a 20-year-old knee. I don't think that's possible. But if something is too good to be true, then we know that it may not be true. But again, look at evidence-based. Medicine is important. It has to be evidence-based.
All right. Now, how do you plan to scale up this technology and the business with KLSMC? With the pandemic that's happening, I'm sure there's been some impact to your business and the progress of your research and getting trials approved. What's next then for you?
Yeah, I mean, when the COVID came and we had our first lockdown in March, luckily we finished our phase 2B trial. So we were very lucky because if we still have to run the trial with the COVID, then it becomes very difficult for us. But business has been affected, like everybody else, because when we had the COVID in March, April, May, June, we were maybe doing about 10% of our work, And now, if you look at this last month and this month, maybe we're doing about 80% or 70%, 80% of what we normally do, because normally we have about 20% of patients that come from abroad. So we are losing that group of patients. They can't come at the moment, but hopefully when the COVID is over, then these patients can return back and have treatment or seek treatment when we see our new patients. But how to scale up? We have a lot of investors, whole of last year, talking to us. If you look at if you look at the IPOs and everything now, all the tech companies now, a lot of the valuation has gone quite high now. Then a lot of the investors are now looking into biotechnology. So when they found out that we finished a phase 2B US FDA trial, and a lot of them are very keen to talk to us because the next phase will be a phase 3. They are talking to us to see how they can help us to fund a phase 3. And we would like to do a phase 3 instead of just one center in the US, maybe add another 1 or 2 centers in the US, maybe a total of 3 centers in the US. And we have colleagues in the UK. When we started our phase 2, we wanted to collaborate with us for phase 2B, so we can include them in our phase 3. And then Asia Pacific, some people from China would like us to bring this technology to China as well. So that would be a huge market for us. But if we can do all that in phase 3, for example, in all this geographical position, it'll be good because when phase 3 is done, then we can commercialize in all these countries.
Well, that sounds really exciting. Well, all the best with your expansion plans. Well, just one last question, Dr. Saw. As an entrepreneur yourself, you took quite a big leap venturing into your own medical practice. Not just that, developing an original therapy procedure. So just wondering, what principles and values do you live by as an entrepreneur?
Yeah, it's from treatment of patient's point of view, the most important thing is that you must do no harm. You cannot do stem cells and then create a problem for patients. So if you use stem cells that you don't know, so if you use embryonic stem cells, you're going to run into problems. We know about it. That's why we chose a tried and tested cells, which is peripheral blood stem cells, which are from patient's own body. So that get rid of the ethical issue. But to do what we're doing in clinical practice, you have to be ethical as well. well, you must do ethical medicine. You can't just simply do your work. You have to do good work. And then we always try to improve. So we always try to fine tune our technique to see, can I do better by doing a different type of physiotherapy? Can I fine tune my surgical technique? So for the FDA trial, we have to develop a special drill so that our colleagues in the US can do the surgical procedure a lot easier. And even currently we are keep on developing instruments. We are currently developing a metal plate, which and a way of correcting crooked bone as well, and adding stem cell for the bone to heal faster. So these are the things that we are doing all the time, striving to improve things. But I always tell my kids that to look at what is right and what is wrong, you basically have to reverse the role, then So if you reverse the role with your patient or somebody else that you're talking to, if you put yourself in the patient's shoes, then you know what needs to be done. And that's simple. When you put yourself in that shoes, then you know that patient always wants good work. They do not want to have surgery that's failed. They want things to be done first time right and everything. And at the end of the day, the results are good. And we always strive to do that. And it's not always possible, especially that we are doing very complex work. So sometimes we can have the results that we desire. Sometimes the results might not be too good, but a lot of times we're dealing with unmet medical needs. That's the issue. So if you look at Daniel's limb, for example, we're very happy that we can regrow the bone for him, but while we are treating him, it was always at the back of my mind that what happens if we fail, if we can't get rid of the infection, if the bone is grown but it's crooked and you can't go back to riding, and what's going to happen. So it's worrying when you're treating complex problems.
That sounds like you're doing absolutely great work, what you're doing, and also the KL Sports Medicine. And hopefully we hear more from you, and maybe once your phase 3 trial is approved, sorted, we can speak again, and perhaps one day, coming over to just have a look at how this actually works, the stem cell therapy that you're doing.
You can, when MCO is over, just come anytime. If you see our physiotherapy unit, you'll be surprised that it's very integrated, and that's the key.
Mm-hmm. All right. Thank you so much, Dr. Saw, for spending some time with us to talk about the work that you're doing. You've been watching AWANI Review with me, Cynthia Ng. We'll see you again in the next episode. Bye.
Thanks, Cynthia. Thanks, bye.
Thank you.